This is a patient who knew that they ground their teeth, but wasn't aware of the type of damage that was involved. You can see how the jaw moves up and down in a very nice, easy way. And when we actually place the jaw in what's considered centric relation and use articulating paper, the first point of contact is that little red dot on the upper right premolar. And it's on the marginal ridge. And when we look at the tooth down below, you can see that that's on the opposing tooth right on the cusp. When we look at the person's bite and we have them bite down, you'll see that there's probably about maybe 2 to 3 millimeters of space, depending on where you look. And there was the slide just a moment ago, and that's how long it takes to get all our teeth together. Now, if you look at the edges of the teeth, particularly the two lower left centrals, you can see all the wear, and into the next tooth structure is the brown area, and the little chips and edges that are also on the adjacent teeth are the lateral incisors. You can also see the patient's tartar, and she's been very good in terms of removing plaque, and she's also a very adamant flosser, and she gets her teeth cleaned twice a year. There's the canine on the lower right, where tooth number 27, you can see the wear that's over in that area. And a little closer look at the edges. You can see all the tartar that's there, and it's truly not a lot for somebody, and there's not a lot of bleeding. But as we start looking at the gum tissue, and we put a little bit of air in different areas to blow the saliva away, you can see how the gum tissue is really irritated and moves very easily. And if you look closely, there's tartar underneath there. And she has a situation where there's been some bone loss, particularly in the posterior teeth. And she's gotten some tenacious tartar that hasn't been removed from underneath the gums. The other thing that's been interesting is if you look at the sealants that are there, you can see the white sealant that's been placed. And we'll get a little closer look here. You can see the sealant, and underneath the sealant is broken away on the second molar there, and you can see the brown spot that was in that vicinity. Here's the inside where you can see the lingual aspect of the gum tissue being irritated. And this particular patient, like I had mentioned, is very good in terms of removing plaque, uses an electric toothbrush, but hasn't been very successful at being able to keep the inflammation around by her teeth. And that's one of the reasons why a person gets their teeth professionally cleaned, so that the gum tissue will be more pink and more vibrant. This is an old filling with a little stain there. It doesn't appear to be anything major. Most likely that could be polished. And here again is another tooth where the sealant is broken out, and you can see a little bit of brown stain, but not really a major concern. And so she's had some really good care over the years, but as we look at her behind her lower, these are her upper teeth. If you look behind, you'll see the wear on the lingual aspect. Here's the canine, and you can see into the next tooth structure there, and actually sharpening up that canine. And then here are the central incisors, where quite a lot of tooth structure has been removed. And she's aware that she occasionally grinds her teeth, but finds wearing any sort of night appliance as being very difficult. Few other fillings, and really not very much posterior wear. All appears to be in the anterior segments. And here's a little more stain from where the sealants came off. Here is the view of the lower left, and you can see that she's been brushing really quite hard. It has actually removed tooth structure on the lower left, and then on the upper left. We take a mirror and look at the recession from a different angle, and you can just see how far in she's been able to do that on her tooth number 14 and 13 and 12. And that's probably not from the grinding, because she's not actually touching those teeth when she grinds, but it's more her toothbrush activity. Probably uses more toothpaste than she should. It's very abrasive, and many people use their electric toothbrush like a standard brush. Here's the edges of her front teeth. You can see some stress fractures, some unusual wear. And when we have her actually grind her teeth to the left, you can see how it goes across that canine right like that and sharpens up that tooth. And when she goes beyond that, she lands just at one spot on that stress fracture on that central incisor right there. And that's all the pressure is going on that tooth. And so that's one of the reasons why she has that stress fracture. And when she moves her teeth just a little bit further forward at the same time, it fills in that other little groove, and you can see the little tiny grooves on the other central as well. And the areas of wear are pretty consistent with how her teeth come together. Now, upon exam,